Hi everyone, Dr. Ariel Ostad here. I wanted to talk to you about a very important topic that tends to come up a lot in the exam room, and that is the use of hyaluronic acid fillers. I find a lot of patients have maybe noted on their friends or on social media people who may be overfilled and therefore they're not looking natural. And it is something that we tend to see as a trend. It is not an issue with the use of hyaluronic acid. It unfortunately has a lot to do with the technique that's used in terms of which product, how it's injected, where it's injected, and really the artistry of creating amazing results in a subtle manner. So much of it is technique dependent and the amount of filler that's put in. I find that in my practice, I'm proud to say I really understand the facial features, proportions, so we can really address these issues by using the correct fillers that are placed in the right place, that does not lead to rounding of the face and overfilling of the face. Having said that, there's also some newer techniques that one can use for people who may not be interested in using hyaluronic acid fillers, and that is using the regenerative powers of your own blood. What I've been doing a lot in the last year is basically doing a procedure called PRFM, which stands for Platelet-Rich Fibrin Matrix. It's utilizing one's own blood. We draw the patient's blood, we spin it in a centrifuge, which separates. We discard the red component, which has the red blood cells, and then we take the clear component, which is plasma, which is packed with growth factors. There are basically molecules like vascular endothelial growth factor, fibroblast growth factor, platelet-derived growth factor. These all induce collagen formation, elastin formation. They do induce neoangiogenesis, which is increased blood flow, therefore the skin looks healthier. But one thing I do is we actually add thrombin to it. Thrombin causes the PRP to become slightly coagulated and therefore turns into a gel. And as a result, it can be used as a biostimulator or as a filler. I've used it very commonly on lower eyelids, laugh lines, forehead wrinkles, and it does definitely stimulate collagen. It can act as a filler. It won't work as well as a filler in terms of immediate effects, but it does definitely slowly induce collagen formation over time. It's a procedure that does need to be repeated, typically about 3 times, done once a month. But my patients are very happy with it, and for those people who really are not interested in using hyaluronic acid fillers, it's definitely another option. We're happy to provide you with more information if you contact the office. I look forward to hearing from you. Thank you.